Now we'll be looking at another procedure which is done before an operation is done to a patient. We call these medical consultations. Right? Now, medical consultations could be done to you at any time, but we're just here to remind students watching this, probably trying to learn about practices in the theater, that medical consultation is also a very important part of a patient's before operation procedures. Okay, so let's look at it. So consultation is just however the patient getting to meet with a specialist in that field, especially the field of what is wrong with the patient. Okay, so it's a very important step. So its aim as you are trying to access and optimize the patient health to reduce what perioperative risk and improve outcomes. So you are meeting with this patient to now look at the patient's well-being and plan out the surgery better. And if there are some things which you have to explain to the patient, you can also have to explain to them better. So preoperative medical consultation is a formal evaluation conducted by a physician, often is somebody specialized in that field in general, or the anesthesiologist can also be there. So they do that before surgery, and they help to identify or just look at the overall health of the patient, trying to rule out any other thing that could have actually led to adverse effects of that operation, or trying to plan the operation better. Okay, so they access all the risks because they took medical history, they do physical examination, they do the lab results, they optimize if there's any infections in the patient apart from the main disease that you guys are going in for the operation. Now they recommend adjustment of any other thing they'll be using there. They coordinate, they bring out a plan, right, where all the healthcare providers that will be involved in that patient to communicate better. Then they can also educate the patient. This is from where you can also even seek informed consent of the patient. So common components, detailed medical history is taken there, physical examination, all the vital signs are still taken. They do the various diagnoses. That's probably the ones that they have not done or something. They stratify and they now bring up the prognosis. They understand all of that to see the possibilities of the patient recovering from any other condition, that condition after the surgery. So benefits of the pre-operative consultation is it reduces complications, help you guys plan better, improves patient outcomes, gives better flow for communication between all the healthcare providers that will be collaborating on that patient. Then of course that's from where you get informed consent. Alright, so this is what we got for this aspect of pre-operative medical consultation.